So talk to me a little bit about that. I think a lot of people would be surprised that it helps if you collect the kidney stones. What can you tell?
Yeah, there are multiple types of kidney stones. The most common type are calcium oxalate stones. About 70% of stones are that type, but there are several other types. And depending on the type of stone, we can also direct specific evaluation and therapy to either dissolve the stone or possibly prevent recurrence.
And speaking of recurrence, is there anything that somebody can do to prevent that, or even to prevent them in the first place? Because if you've ever talked to anybody, they do say they're agonizing.
Yes, I think there are many things that can be done, both in terms of general health issues that patients will have, as well as evaluations that myself or other physicians can do. Dietary issues are paramount to preventing kidney stone recurrence or even in the first place, and there are diet issues that are very applicable to general health anyway. A low salt diet is important. Low sugar is important. Fruits and vegetables, high dietary calcium, plenty of water or beverage intake. Those are obviously basics for heart healthy and general dietary health anyway. More specifically though, we can evaluate other aspects of urine components and direct more specific types of therapy, sometimes medication and the like. But kidney stones definitely recur, and the excitement of the initial stone in terms of the pain, the procedures needed to remove it are often the main issue, but afterwards the interest in preventing it is not there. And I think that should be a major change going forward, because there are many issues, dietary, medicine, evaluation that can be done to prevent them occurring again the second time.
And it could be something more serious. I mean, I would think, you would definitely probably want to follow up with your doctor after you pass one. You might be like, the relief is here, I'm not in pain anymore, but you would suggest definitely calling a doctor.
Absolutely, because sometimes we want to re-image the kidney. There's sometimes other stones that are present, and as people recognize, they accumulate over time, and we'd like to prevent them from occurring in general. A lot of the pain control, which was directed at kidney stones, was opioid-based, and in this day and age, we'd like to minimize the use of that. And obviously, if we can eliminate the diagnosis of a kidney stone, then we can lessen the potential patients that would receive opioids. And that's certainly a big component of trying to avoid problems that happen.
Absolutely. Well, thank you for coming in. We appreciate it. We're going to give everybody the number. If you have any other questions or you'd like a referral, here's the number to call, 1-800-MD-MERCY. So thanks again, Doc, for coming in.
Thank you very much for having me.